Okay, so I'm going to walk into the patient's room. I'm going to assess the orders. I'm going to ask the patient's name and date of birth. I'm going to make sure that they have no allergies. I'm then going to educate the patient on what we're going to be doing here today and make sure that they don't have any questions. At that point, I'm going to place the patient in a comfortable position after washing and donning gloves, washing my hands and donning gloves. And then I'm going to place the patient in a comfortable position. I'm going to put the tourniquet on the patient. I'm going to then assess the patient's hands and arms, inspect it, and I'm going to palpate it with my index finger. I'm going to try and assess and find the right vein for this procedure. And then I'm going to release the tourniquet. I'm going to swab that area of the vein that I'm going to be using with the alcohol swab. I'm going to let it air dry, and I'm going to re-put on the tourniquet. At this time, I'm going to grab the needle with my dominant hand. I'm going to anchor with my non-dominant hand with the bevel of the needle up at a 10 to 30 degree angle. I'm going to quickly insert the needle, and then I'm going to advance the catheter about 1/4 of an inch until I see a blood return. And then I'm going to apply 3 centimeters of pressure above the insertion site, and I'm going to stabilize the catheter and remove the needle and stabilize with my dominant index finger. And then I'm going to release the tourniquet. I'm going to apply a little bit of pressure. I'm going to connect the saline tube. I'm going to then check for patency, and I'm going to I'm going to check for patency, and then I'm going to secure the IV with a med device band-aid, and then I'm going to grab my transparent band-aid and put it over, making sure not to cover the hub or the connection. And then I'm going to remove the saline. I'm going to clean my patient's port, IV port, and then I'm going to lube it, and I'm going to tape it to my patient's arm with my tape. At that point, I'm going to assess the orders and make sure that I put the flow rate at the right order according to my orders. And then I'm going to wash my hands, and I'm going to assess my patient. I'm going to make sure that they're not in any discomfort or distress. I'm going to ask them if they have any questions, and then I'm going to document everything I've done here today. And I'm also going to make sure to put the date and time of the procedure that I've done on the band-aid of the IV site.